cardiologist. We're now joined by Dr. Sonia Lal Gupta, Director, Metro Group of Hospitals and Neurologist. Thank you so much for joining us this morning. Dr. Gupta, if you could first and foremost tell us, are you hopeful now with the Supreme Court directing the centre to ensure oxygen supply to the capital that perhaps, this day-to-day frustration that many of you are facing may get resolved?
Hopefully, Gargi, I think at this point we just don't know. Looking at the situation, this is not that one episode has happened, multiple episodes have happened. And being in the forefront, when we see that we've faced that situation ourselves where, you have 3 minutes of oxygen left and you're just standing there praying helplessly and you see the truck coming in. I mean, nobody can imagine the trauma, the mental trauma each person is going through at that time. So I think it's easier said than done, it's very easy to direct someone that this is you better do this. But the question is, what are the repercussions if it's not done? The repercussion is that people are dying, and that is just not right. So I think there has to be some strict now goals by the central government. They have to look at the oxygen crisis. This is not the crisis we should be fighting. There's a lot more we have to do, not just to give oxygen to our patients.
Right, no, absolutely. And, people are dying outside of hospitals. Now you have people dying inside the hospital. But what happened at Batra Hospital on Saturday, and before that, you had another hospital, Golden Jaipur Hospital, in which another 20 people had died. And what is really frustrating and angering is the fact that it's been over 12 days. This crisis didn't start just yesterday. It's been 12 days that you've had the national capital grappling with this crisis, hospitals sending out videos, SOS calls, SMSs, journals, getting them all the time. And it's been 12 days. I can't emphasize that enough, that the national capital has been facing this and we still haven't been able to resolve it.
Exactly. And I think that is where the problem is, and that is where everybody needs to wake up. It's not a matter of a day. It's an everyday issue with multiple hospitals, multiple lives on stake. And as you said, it's just not about finding a bed. Everybody, I'm sure, is getting 100 calls a day for bed. That's one part of the issue. The problem is once the patient is in, to make sure they're getting the oxygen, the treatment is another issue altogether. So it's a very, very helpless situation. And I think really at this point, it's good the Supreme Court is becoming vocal about it. So at least there's some awareness rising. But really, I think some strict action needs to be taken if the demands are not met. It's just not about a directive at this point.
Right, and Delhi is such that we don't have any industries. We can't requisition oxygen from we don't have any steel industries here or factories, etc. And we need to depend on the centre for getting it from outside. We're also joined by Dr. Nilesh Gautam, interventional cardiologist, SL Raheja Hospital in Mumbai. Dr. Gautam, if you could share with us what the situation is like there. At the same time the Delhi crisis began, the Mumbai crisis also began over oxygen shortage.
Good morning. Yes, I do agree, but here we were a little, I think about a week early or 10 days early as compared to Delhi. Yes, the situation is almost the same and similar, but at the SL Raheja, we have been sort of prepared and the crisis is being managed to its optimal, I would like to say that.
So are you saying that in Mumbai at least you're getting regular oxygen supplies?
Yes, from what I hear, at least it's better than what it is in Delhi. So it is not so bad, but we are managing to hold on, yes.
Right, and cases in Mumbai have been, coming down, and people are hopeful that this will turn into a trend. Of course, if it's just 1 or 2 days, we can't say. If you could tell us the latest that you're seeing there.
The trend is definitely positive. It looks encouraging. The number of admissions, yes, have gone down, but the crisis remains, the shortage of bed remains. But overall, the number of inquiries and the individuals requiring hospitalization and the positivity rate, definitely we at the ground level, what are seeing is going down. Thank you.
All right, so that's a positive, reports that are coming out from Mumbai. We're joined by Dr. Dhiman Kahali, Director, Interventional Cardiology, the BM Birla Heart Research Institute from Kolkata. Thank you so much, Dr. Kahali. You must be relieved that finally the elections are over and now everybody can get down to the business of handling this crisis, because we have been seeing the COVID cases in Bengal and in Kolkata just escalating.
Yeah, it's terrible actually in Kolkata now. Every other admission has been suffering from COVID, even cardiological admissions who has been suffering from acute heart attack. And because of different reasons, election here, there is no masking, big gatherings occurring, no social distancing. So this has precipitated the issue, and the disease is rampant. But fortunately, it's little less than the other parts like Mumbai, Maharashtra, and Delhi. The death rate is also little less, but the numbers are rising. There is no doubt about it. But there is semi-lockdown by our Chief Minister, and our Chief Minister has been taking very positive steps. But unfortunately, across the country, like Kumbh Mela, and that there was 90 lakhs holy dips during the Kumbh Mela, and it has been criticized by all the top shots in the medical fraternity and also the different news channels across the globe. And
I can just imagine the frustration of you doctors, watching such massive gatherings taking place at a time when you have dealt with this crisis for over a year now and are still dealing with it. Dr. Kahali, if you could tell us, we also believe there's a shortage of hospital beds there. Even in Kolkata, it's a desperate fight to get a patient into a hospital.
Yeah, there is definitely a lack of beds here also, because patients are coming, and every day there is a long queue in the hospitals and people are not getting beds at proper time. But we are managing the situation somehow. We are keeping them in the emergency department, and we have got online registration, and we are trying to accommodate each and everybody. Fortunately, majority of the patients are getting beds, and as I have been listening for the last few days in your channel too, and just now also, that there is oxygen shortage in Mumbai, Delhi, but fortunately, mainly in Delhi, but fortunately in eastern part, as the manufacturing is here, the steel plants are here, like Durgapur steel plant, the ISCO in Burnpur, and there are several other facilities where industrial oxygen is generated. And as we know, that there is not much of a difference between industrial oxygen and the oxygen required for the medical use. It's almost the same. In industry, it is 99.5% oxygen, and in medicine, it is 93.5 plus minus 3%. So it's all the same. And fortunately, in eastern part, because of good management by our Chief Minister and also the local administration, and also good management by the CEOs of different hospitals, as of now, we haven't faced the oxygen crisis. And we have got the steel factories nearby. Like Durgapur is 200 kilometers from Kolkata. And I hope that the supply chain should be proper. Of course, there is semi-lockdown in our West Bengal, state of West Bengal.
Right.
And we've been very cautious. And now Didi is also doing a lot of work to prevent the disease. And
well, it's good
also,
to know that you're not facing the oxygen shortage that we're facing, but the number of cases rising in Kolkata and Bengal is a huge worry. And yes, hopefully the administration will get down to the business of tackling this second wave of COVID. Dr. Sonia, another issue is that even in Delhi, we're seeing that new centers are being created, these makeshift hospitals are being created, but many people are asking, where is the staff? Where are we going to get all the doctors and nurses to run these centers?
Exactly,
yeah,
and that's another problem. I think shortage of
shortage.
healthcare personnel has always been an issue
Shortage
from the beginning.
doctors and nurses, and they are exhausted too, because for 12 hours they're with the PP, they can't drink, they can't eat, they can't go to the washroom. This is a terrible situation. But hats to them. Every day I give hats to them, the persons working in our CCU, that with PPE they have been not drinking, not eating anything, and for 12 hours. But the workforce is getting exhausted. So what we have to do at a national level, we should have a disaster unit, disaster management team, and we should also see that we have extra doctors. The MBBS final year doctors, they are well trained, all of them. They are preparing for the exams. Their exams should be stopped, and they should be taken in the workforce, even in the rural areas.
Right.
Because the metros in Kolkata, we have sufficient workforce. But if you go little away, I think we need more workforce, more trained workforce, and the final year nursing students should also be taken. And the demand of the
I'm running out of time. I just like to get Dr. Sonia and also on this issue, and that's something that I've heard a lot from doctors of roping in the students. Dr. Sonia?
No, absolutely. In fact, we have our we ourselves, our students are also in clinical rotations. We have a nursing college, and our students in the second year, third year, We've roped them in wherever we can. So definitely that is one solution. And I think eventually India needs to, moving forward, plan ways where we can train more people with simpler courses, at least to take care of basic management to deal with this issue. I think it's a national issue, no doubt.
Though right now, of course, it's the crisis at hand, and all you doctors, you raise the same issue of a centralized command, a centralized agency or centralized team panel that will just look into all these issues, especially the oxygen crisis that we're facing here in the national capital. Thank you so much, doctors, for sparing your time and joining us on the channel today.